Infertility and thin endometrium.
Thin endometrium can lead to infertility, miscarriages, and ectopic pregnancies.
Even chemical pregnancies. Why is that? Because when the sperm fertilizes the egg, it forms an embryo, which needs to implant in the endometrium to develop.
The endometrium is like the soil, and the fertilized egg is the seed.
If the endometrium is extremely thin, it lacks sufficient nutrients and cannot support implantation, resulting in inevitable infertility.
The treatment for thin endometrium cannot be generalized.
It is necessary to diagnose the underlying cause of thin endometrium before treating it.
Some may wonder how to diagnose it, as doctors only mention thin endometrium. Not necessarily, because the endometrium thickness is measured on days 21 to 24 of the menstrual cycle, which is more than 20 days after the start of menstruation. In other words, it should be measured about 1 week after ovulation. The endometrium is naturally thin right after menstruation.
The normal thickness of the endometrium ranges from 0.8 to 1.2.
If it measures below 0.8 centimeters between days 21 and 25 of the menstrual cycle,
in a normal 28-day cycle, it is considered thin.
The causes of thin endometrium can vary.
Firstly, it could be due to uterine adhesions, excessive manipulation of the uterine cavity, or previous abortions, resulting in endometrial damage.
Secondly, hormonal imbalances and endocrine disorders play a role, such as insufficient estrogen levels, premature ovarian failure, or diminished ovarian reserve. Insufficient progesterone function or low progesterone levels can also hinder the transformation of proliferative endometrium into secretory endometrium,
leading to thin endometrium observed via ultrasound. Ultrasound is the gold standard for diagnosing endometrial thickness. But the timing of the examination is crucial.
For a menstrual cycle of 28 days, the endometrium should be measured between days 20 and 25.
However, if the menstrual cycle is longer, it is important to check for ovulation. Endometrial thickness should be measured 1 week after ovulation to obtain meaningful results. Measuring endometrium without ovulation is meaningless and cannot provide information about thickness.
Therefore, monitoring ovulation is necessary before evaluating endometrial thickness. Clinical diagnosis relies on the doctor's experience and scientific approach. Otherwise, it would be baseless to determine thickness based on a single ultrasound examination.
The treatment should address the underlying cause. If thin endometrium is caused by hormonal imbalances, hormonal regulation is necessary.
Supplementing appropriate hormones, including growth hormones, can increase endometrial thickness.
However, excessive hormone supplementation should be avoided and maintained at a normal level. Some doctors prescribe excessive doses of estrogen to patients, taking more than 20 pills per day. Isn't that harmful?
Furthermore, the receptors in the endometrium have limitations. Taking excessive hormones only increases side effects, not positive effects.
Even if all the receptors are occupied, additional supplementation won't be effective. Under normal circumstances, 1 to 2 pills are sufficient. For estrogen and progesterone, 1 to 2 milligrams are taken. The principle of supplementation is to address deficiencies and supplement accordingly. If there are uterine adhesions, surgical intervention is required to separate the adhesions.
A uterine shaping device is placed under hysteroscopy, and the outer surface of the device is coated with biocompatible adhesive membrane or
transplanted endometrial cells. After the procedure, both thin endometrium and uterine adhesions are effectively treated. Beijing Antai Hospital offers contracted treatment, and if the desired outcome is not achieved, a full refund will be provided.